Hey guys, welcome to Medifaction. Today we will be learning about the physiology of Cushing's syndrome. So, Cushing syndrome is a condition that occurs from exposure to high cortisol levels for a long time. So, to learn more about Cushing syndrome, let's start learning. So, in this video, I will be enumerating an introduction, the causes for Cushing syndrome, and the types which may be due to pituitary origin or adrenal origin, signs and symptoms, tests related to it, treatment for Cushing syndrome, and finally Nelson syndrome. Let's start. Introduction. Cushing syndrome is a disorder characterized by obesity. This is how a typical patient will be looking like. Causes. Cushing syndrome is due to the hypersecretion of glucocorticoids, particularly cortisol. It may be either due to pituitary origin or adrenal origin. If it is due to pituitary origin, it is known as Cushing disease. If it is due to adrenal origin, it is called Cushing syndrome. Pituitary origin. Increased secretion of ACTH or adrenocorticotropic hormone causes hyperplasia of adrenal cortex, leading to hypersecretion of glucocorticoid. ACTH secretion is increased in number 1. Tumor in pituitary cells, particularly in basophilic cells which secrete ACTH. Number 2. Malignant tumor of non-endocrine origin like cancer of lungs or abdominal viscera. Number 3. Hypothalamic disorder causing hypersecretion of corticotropin releasing hormone. Adrenal origin. Cortisol secretion is increased by number 1. Tumor in zona fasciculata of adrenal cortex. Number 2. Carcinoma of adrenal cortex. Number 3. Prolonged treatment of chronic inflammatory diseases like rheumatoid arthritis with high dose of exogenous glucocorticoids. Number 4. Prolonged treatment with high dose of ACTH which stimulates adrenal cortex to secrete excess glucocorticoids. Recently, Cushing syndrome is classified into two types. ACTH-dependent Cushing syndrome, which is due to hypersecretion of ACTH. Number 2 is ACTH-independent Cushing syndrome, in which the secretion of ACTH is normal. The syndrome develops due to abnormal membrane receptor for some peptide like interleukin-1, gonadotropin-releasing hormone, and gastric inhibitory polypeptide in the cells of zona fasciculata. The binding of these peptides to the abnormal receptors increases secretion of glucocorticoids, resulting in Cushing syndrome. Cushing syndrome that is developed by treatment with exogenous glucocorticoids also belongs to this type. Signs and symptoms. Number 1. Characteristic feature of this disease is the disproportionate distribution of body fat, resulting in some abnormal features. A. Moon face. The edematous facial appearance due to fat accumulation and retention of water and salt. B. Torso. Fat accumulation in the chest and abdomen. Arms and legs are very slim in proportion to torso. Torso means trunk of the body. C. Buffalo hump. Due to fat deposition on the back of neck and shoulder. D. Pot belly. Due to fat accumulation in upper abdomen. Number 2. Purple striae. Reddish purple stripes on abdomen due to three reasons. A. Stretching of abdominal wall by excess subcutaneous fat. B. Rupture of subdermal tissues due to stretching. C. Deficiency of collagen fibers due to protein depletion. So here you can identify the purple striae and cardiac hypertrophy, a red and round face. The patient may develop osteoporosis, muscle wasting, skin ulcers, etc. Continue. 3. Thinning of extremities. Number 4. Thinning of skin and subcutaneous tissue due to protein depletion caused by increased catabolism of proteins. Number 5. Aponthosis. Skin disease characterized by darkened skin patches in certain areas such as axilla, neck and groin. 6. Pigmentation of skin, especially in ACTH dependent type due to hypersecretion of ACTH, which has got melanocyte-stimulating effect. 7. Facial plethora, that is facial redness. Number 8 is Hirsutism, heavy growth of body and facial hair. 9. Weakening of muscle because of protein depletion. 10. Bone resorption and osteoporosis due to protein depletion. Bone becomes susceptible to easy fracture. 11. Hyperglycemia due to gluconeogenesis, that is from proteins, and inhibition of peripheral utilization of glucose. Hyperglycemia leads to glycosuria and adrenal diabetes. 12. Hypertension by the mineralocorticoids effects of glucocorticoids. Retention of sodium and water results in increase in extracellular fluid volume and blood volume, leading to hypertension. 13. Immunosuppression resulting in susceptibility for infection. 14. Poor wound healing. Now let's check the test for Cushing syndrome. Number 1 is nothing but observation of morphology or external features. Number 2 is determination of blood sugar and cortisol level. Treatment for Cushing syndrome. Treatment depends upon the cause of the disease. Treatment may include cortisol inhibiting drugs, surgical removal of pituitary or adrenal tumor, radiation or chemotherapy. Now let's learn about the Nelson syndrome. Nelson syndrome is a disorder that develops after surgical removal of both adrenal glands. It is because of the growth of pituitary tumor that secretes excess ACTH. The features include headache and visual problems. Nelson syndrome can be treated with radiation or surgical removal of the pituitary gland. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.